Welcome to This Explainer. Right now, there is a genuinely remarkable and rapidly unfolding situation that's been grabbing global headlines. We are talking about a deadly viral outbreak aboard a cruise ship, the MV Hondius. It's a story that involves specialized military hospitals, international repatriation flights, and biocontainment units that look like they're straight out of a sci-fi movie. But, underneath all those sensational headlines, what is actually going on? Well, today we're going to unpack the facts, the timeline, and the massive global response to this incredibly rare event. Let's get into it. Okay, let's dive into this by starting with the absolutely most important piece of information for you at home. The message from Dr. Tedros Adhanom Ghebreyesus, the Director General of the World Health Organization, is crystal clear. He says, this is not another COVID, and the risk to the public is low. Health officials have spent years studying this specific virus, and they're really urging the public to just trust their judgment and not panic. But that reassuring quote brings up a really glaring contradiction, doesn't it? If you've seen any of the news footage, you've seen workers in full hazmat suits, wearing respirators, with their faces shielded behind heavy-duty protective gear. So if the risk is genuinely so low, why on earth are these passengers being evacuated on customized planes basically wrapped in plastic and escorted by top-tier epidemiologists? That striking contrast between the WHO's calming words and these highly militarized, dramatic visuals is the central mystery we're going to solve for you in this explainer.
To really understand the extreme caution, we first have to look at how this ship was actually evacuated. When it docked in Spain's Canary Islands, this wasn't a standard disembarkation. It was supervised by Spain's top health and interior ministers alongside the WHO. Oceanwide Expeditions, that's the ship's operator, couldn't just let passengers casually walk down the gangway. Instead, they executed this incredibly complex, highly restricted operation. Passengers and crew were taken off the ship in tiny launch boats holding just 5 to 10 people at a time. Once they hit the shore, they went through rigorous symptom checks, were handled entirely by port workers in full protective gear, and were immediately isolated by nationality before boarding their respective repatriation flights. They had absolutely zero contact with the local population in Tenerife.
And the sheer logistics of this operation? Absolutely staggering. And that's because of the scale of potential exposure. The MV Hondius was carrying nearly 150 people. And these weren't people from just one region either. They hailed from more than 15 different countries, including 17 American citizens. Think about it. A virus on a cruise ship is essentially a pathogen with a passport, presenting just a massive, decentralized puzzle for global health agencies to try and track down. And this brilliantly illustrates exactly why such an extreme protocol was activated. The pathogen in question here is hantavirus. Now, typically, hantaviruses are contracted through contact with rodent urine, droppings, or saliva. They don't normally spread from person to person at all. However, the patients involved in this specific outbreak tested positive for the Andes strain, which is found in Latin America. The Andes strain is uniquely dangerous because it is literally the only strain of hantavirus known to be capable of human-to-human transmission. That single, tiny evolutionary trait is exactly what triggered this massive global response. Compounding that danger is the virus's incredibly stealthy timeline. According to the CDC, symptoms of hantavirus can take up to a staggering 8 weeks to develop after initial contact. 8 whole weeks! This incredibly long incubation window is precisely why health officials must monitor these passengers so strictly right now. Because you could feel perfectly fine, test totally negative, and still be harboring a virus that suddenly manifests weeks later. So you're probably wondering, how did a Latin American rodent virus end up on a cruise ship headed toward Africa in the first place? Well, the investigation points to patient 0, a Dutch couple. Prior to boarding the MV Hondius, a 70-year-old man and his 69-year-old wife spent weeks on a bird-watching trip through Argentina, Chile, and Uruguay. Those are areas where the specific rodents carrying the Andes virus actually live. On April 1st, the ship sailed from Argentina. By April 6th, the man developed symptoms. And tragically, on April 11th, he passed away right there on the ship. But here's the thing, because his symptoms mirrored standard respiratory viruses, hantavirus wasn't even suspected, so no early samples were ever taken. Let's move to the next part of the timeline and see how this builds, because unaware of the true cause of death, the ship just kept on going across the South Atlantic. From April 21st to the 24th, the vessel stopped at the British territorial island of St. Helena, where the deceased man's wife went ashore. She later boarded a flight to Johannesburg, South Africa, developed serious symptoms mid-flight, and sadly died on April 26th. It was the testing at this point that finally confirmed the presence of hantavirus. Shortly after, a German woman still on the ship began showing symptoms on April 28th, and she passed away aboard the vessel on May 2nd. Which brings us to the sobering human cost of this outbreak. To date, there have been at least 9 confirmed or suspected cases linked to the Hondius, resulting in 3 fatalities. So while yes, the public risk is low, the stakes for the individuals actually exposed to this Andes strain are incredibly high and, sadly, lethal in several instances. The tragic delay in actually identifying the virus led to a massive geographic spread, which basically made containment an international nightmare. Before anyone even knew there was an outbreak, 32 passengers from about a dozen different countries had already disembarked the Hondius in St. Helena. Now health officials are scrambling to track this tangled web. Because of this, evacuated or medically airlifted patients are currently scattered all across the globe, receiving care in the Netherlands, a hospital in Switzerland, and facilities in South Africa. Another British national is even hospitalized on the incredibly remote island of Tristan da Cunha. Let's look closely at the United States evacuation effort just to see how they're handling this delicate situation. The U.S. sent a specialized CDC and HHS repatriation flight for its citizens. During the operation, 2 Americans required entirely separate management. One tested mildly PCR positive, meaning they had trace amounts of the virus's genetic material, but was totally asymptomatic. Another actually began experiencing active symptoms. So, out of an abundance of caution, both of these individuals were totally separated from the rest of the group and traveled in the plane's specialized biocontainment units. So, what was the final destination for this flight carrying 17 Americans and 1 British resident? Omaha, Nebraska, specifically the National Quarantine Unit at the University of Nebraska Medical Center. Here, each passenger is provided their own completely isolated room, where they will be heavily monitored for an unspecified amount of time. It's actually one of the most advanced biocontainment facilities in the country, designed exactly for high-stakes, unknown pathogen observation just like this. But you might be wondering, wait, what about the people who got off the ship early and flew home on normal commercial flights before anyone knew there was a problem? Well, the CDC confirmed that 7 Americans left the cruise early and have already been living back in the U.S. for roughly 2 weeks now. But don't worry, state health agencies in California, Georgia, Texas, Virginia, and Arizona are actively monitoring these individuals right now. They're well into their 8-week incubation window, and local health departments are watching them like a hawk. Now, what's really interesting about this slide is how the international community uniformly agreed on the severity of the quarantine, even if their specific methods kind of varied. The U.S. utilized high-tech biocontainment in Nebraska. British authorities opted for immediate hospital observation for their returning citizens. Spain transported their 14 nationals to a military hospital in Madrid for quarantine. Meanwhile, France's prime minister issued a decree enforcing strict isolation, not just for the passengers on the repatriation flight, but also for their close contacts. Everyone is taking this absolutely seriously. Which brings us right back to resolving that central mystery we introduced earlier. The reason we're seeing all these hazmat suits while health officials simultaneously tell us not to panic. It all comes down to targeted risk. The risk to the individual passengers exposed on that ship is incredibly high. The virus is lethal and transmissible among close contacts. However, because these individuals have been perfectly isolated in essentially a closed system since the outbreak was identified, the risk to the general public, meaning you and me, remains very, very low. So the crucial point here is summarized perfectly by former FDA Commissioner Scott Gottlieb. He noted that the U.S. passengers being brought home are likely reaching the absolute peak of the virus's incubation cycle right now. As each day passes under strict medical observation without an outbreak spreading, we are, as he put it, nearing the end of the transmission window. The protocols, as totally dramatic as they look on TV, are working exactly as intended to burn out the virus in isolation. As for the MV Hondius itself, well, its journey isn't quite over yet. Following the massive, complex evacuation in Tenerife, the ship took on supplies and is now basically operated by a skeleton crew. Tragically carrying the body of 1 passenger who passed away on board, it is currently on a 5-day voyage toward Rotterdam in the Netherlands. Once it finally gets there, Spanish authorities confirm the vessel will undergo a massive, top-to-bottom disinfection process before it is ever allowed to sail again. The story of the MV Hondius is just a fascinating and frankly sobering look at modern epidemiology. I mean, a localized pathogen from a tiny rodent in South America managed to board a ship, travel the Atlantic, and trigger a synchronized multinational military and medical response. It really leaves us with a compelling thought to consider. As global travel increasingly brings remote pathogens right to our doorsteps, are our international containment protocols truly ready for the next unknown? What we saw this week definitely suggests we have the tools, but man, the margin for error is razor thin. Thank you so much for joining me on this explainer. Keep asking questions, and I'll see you next time.